Somerset Hospital was facing declining inpatient volume, which was contributing to a decreasing financial margins as well. So we knew that we had to reverse this trend. It's a trend that many hospitals, particularly smaller hospitals across the country, are experiencing. So we were looking for opportunities on both the revenue and expense side. On the expense side, our labor costs were approaching 50% of our total operating costs. So we knew that that was an area that required special attention. We needed an objective way to determine what our staffing should be. Our staffing in each department had really always been determined based on what it had always been. There was no objective criteria to say that that was the right staffing. So we needed an objective assessment of each of our departments to see what our staffing should be so that we could reduce our labor costs. Somerset Hospital engaged Altius Healthcare Consulting to come in and perform an objective assessment of our staffing by department to determine whether it was the appropriate staffing level or not. And then we also wanted them to provide us with a tool that would allow us to determine appropriate staffing depending on the volume that the department was experiencing at that time. The results were probably more than we expected. We were able to reduce our full-time equivalent employees by 40, which was about 7% of our total FTEs. We set our department, 68% of our departments now have a benchmark at or above the 75th percentile for staffing. We intentionally left some departments at the 50th percentile, such as nursing, but many departments are at the 90th percentile as well. But just as importantly, we've been able to sustain that staffing level through the benchmark, which in the past we would reduce FTEs and then we would see them creep back. But by using the tools that Altius provided, we've been able to maintain the same staffing level now for about 3 years. And more important, just as important, when we now are able to budget our FTEs by department based on the benchmarks that Altius provided. And we also use those benchmarks to determine whether we should approve a replacement position or a new position when managers request them.